Hello, everyone, and welcome to this week's vlog. Over the past several weeks, we've been profiling the great work of our people across the province, both on the front lines and behind the scenes. And while that work is very important, I felt it was time to mix things up a bit. So instead of talking about a particular team or initiative today, I want to talk about gratitude and some of the silver linings we found during COVID. We know that we can never bring back the people that we've lost, and even that in itself. I don't think any of us want to go through a pandemic again, but really the incredible work that you've all done, the compassion, the care, and also watching the type of compassion fatigue that you're going through. We know it's not been easy, but we also know there are things that we need to be grateful for. I'm incredibly grateful for all of you, for all the things that you've done to help Albertans. And I know that it's not been easy, but know that we so much appreciate everything that you do, whether it be in the front lines or in the back office. As for myself personally, I'm really thankful and grateful that my parents are staying healthy. As I mentioned before, my father's 89, my mom is 86. I've probably seen them more, to be honest, over this COVID period, taking them for walks over the past 3 months than I have before that. And just listening to some of the stories my father is sharing with me about the time that he grew up in Hong Kong and what brought us over to Canada. So for me, that's the silver lining, to get to know my parents even more than I have before, and to know that they're staying healthy throughout all of this. Now I'd like to turn it over to some of our colleagues for their thoughts and hear what they are thankful for.
When you have challenges thrown on your system like this, the thing that I'm grateful for is the ability to come together and do what's needed to be done, where silos and politics are put aside and we solve problems and we take care of patients. And that's certainly what we've seen in COVID. And not just at a site or a zone or a program level, but across the province. Everybody's helping each other. And I think that will bring our organization even further together.
So when I think about what I'm grateful for, I mean, I have an AHS role, but I'm also a family member and of patients at times. And over the past couple of years, a couple of family members have had unexpected health problems, and 2 of them cropped up during COVID. And I was so grateful for the professionalism that the staff showed to them, and for the caring, and for the nurses, even though we couldn't visit my niece in the hospital, how caring the nurses were and how thoughtful they were, and just how amazing the patient's journey's been for another one of my family members. So I'm so grateful for the staff that have continued to show all their professionalism and caring through this time. And you know, professionally, I'm so grateful for all the help that and all the colleagues that I've got within the strategic clinical networks, and even more broadly within the scientific advisory group.
I'm grateful that during this pandemic, unlike other areas in our country, we have had constant supply of PPE and other products needed to fight this pandemic. I've also appreciated the transparency from the leadership group on down as information is shared with us on the front lines.
Of course, besides my family, I'm very grateful for the country in which we live, our healthcare system, our freedoms, and the job that I have, and just many things that so many other people in other countries don't have and we may take for granted.
COVID-19 gave me a time to change habits in my life and come back to myself and put up good boundaries and remind myself that to pay attention to my family, to pay attention to myself. So that's my silver lining in COVID.
Especially in times of, like this, in a pandemic, you really want to trust the experts. You want to know that you're in capable hands, and we are in Canada. And, with all the big feelings that everyone's experiencing right now, you really need to feel that if you get sick, you are in capable hands. And we definitely have that, with doctors, nurses, operations staff, administrative staff. You also need a friendly face when you go into the hospital. So it's everybody, the cleaners, everybody. Like, we have a really strong healthcare system in Canada, and and we're very fortunate in Alberta as well, with the caliber of physicians and nurses and healthcare staff that we have. So I think that's not to be taken for granted, especially in times like this. I look at friends and family around the world, and I've got friends and family all over, and we're every day, I'm very thankful that I am here and not somewhere else.
Our silver lining is the increased opportunity for work in the field of virtual healthcare. We have had a lot of help from our on-site virtual health team, provincial teams in IT, Connect Care, and our physicians were really able to ramp up quickly to be able to meet privacy legislation, clinical practice standards, and AHS policies during this time. We know that virtual health isn't something that's applicable in all cases, but we've had many successes using this technology.
Well, there's definitely been some silver linings. It's fun to work at home a couple of days a week, but the coordination and integration we've seen between different facets of the healthcare system, primary care and specialists, primary care in the hospitals, the strategic clinical networks and operations, like people all focused on one issue and one priority, and people being, working together respectfully and everybody rowing in the same direction. It's been amazing to see that over the last 5 months.
Thanks to everyone for sharing their thoughts and reminding us that there is still so much to be thankful for. And if you want to see how grateful people are for the work that you do, just head over to our Thanks for Caring, Thank a Paramedic, and Share the Love webpage. These notes come from patients, families, and your colleagues from all over the province. I'd like to share a note one of our people left recently. I'm so proud to be part of this team. For whatever role you play in patient care, I'm so grateful to call you a part of my team. These past months have not been easy, and some days very hard to keep walking in the doors to work, but together we can encourage others. I'm also very proud to be part of AHS and could not be more thankful for the work that you do. You are an amazing team that's not only focused on protecting and caring for Albertans, but also being there for one another. I know that there have been hard times during this pandemic, and there's still a long path ahead of us as we continue to manage COVID-19 and protect our patients and each other. While our leadership team continues to look for more ways to sustain and to strengthen you, I encourage you to keep supporting one another, whether that's through some encouraging words of gratitude, sending an e-card, or even just listening. These things really make a difference. And as we head into the long weekend, I hope you're able to connect with your loved ones, even if it has to be virtual. Rest, recharge, and express what you are thankful for. Thank you, and I'll see you next week.
Together, we do amazing things every day.